So good evening for all those who have come for celebrating my superannuation. My special thanks to Director Sir, Madam Nina, our Dean Academic, Subrato, our Dean Research, Arvind Bagga, my colleague, incoming head of the department, all the faculty members, all the residents who are DM, junior resident, all the nurses, all the faculty members from various departments, and the office staff and the research staff who have gathered here for this function. I am really touched with the words which I listened through from all of you. And to me, running a department which is multifaceted, sir, with multiple super specialties, 50 DM students, total 25 faculty members, 42 MD resident doctors, nearly 30 non-academic SRs. In addition to all this, actively engaged into mentoring future generation of UG students, the nursing students, all the nurses who are working in the ICUs, in the wards, in the ER department, sir. We are so lucky you gave us the space where we are able to stabilize our patients, our research staff, PhD students. I think running a department which has real brainy people is not an easy task, sir. And to work together collectively is another not an easy task. I learned through in the last 4.5 years, I never thought I am going to be the head of the Department of Pediatrics. But one day Vinod walks in my room and says he's joining and taking a deputation to DTIO. And here is Ashok Chitti, you have to take as HOD. I moved into that room, sat there, did no renovation, nothing. Very room, same chair, no chair changed, and took over that responsibility as head of the department. But I learned from each and every faculty member, each and every staff who worked with me, the resident doctors with whom I interacted, from the nursing staff who were working in the wards, in the ER. And then what I kept on doing in the last 4.5 years was not only the Department of Pediatrics, sir, because you entrusted me with a lot of other responsibilities. Maybe it may be prevention of mosquito-borne diseases. Chair that, Ashok. You have to work with the sanitation staff and make sure that we don't have dengue epidemic. And sir, I'm so happy at this point of time. During those 4 years, it never happened because we were doing all run charts and tracking what is happening, and the containment and contact tracing was happening in the entire hospital and the hostel. Then you gave me another responsibility. Ashok, just take this skill lab. And I would tell the younger people that whatever you do, you have to do with you have to put your soul into it, your heart into it, and do with dedication and sincerity. And all work which you do, you cannot do it alone. You have to make a good team of individuals who will work with you. You delegate responsibility to people, let them do it, give them the reward, appreciate them, and then keep on moving with the next target. Keep the target high. Don't stop at one point of time. Think ahead what the scene would be. And as I moved, sir, in simulation, I also pushed people that we need to get to augmented reality, virtual reality, the way forward for doing education for people, 3-dimensional, how you will do. And then I used to interact with this young boy who is startup in Indore. He's doing AR, VR. So I used to interact with him. So think ahead how the shape is going to be for education, for healthcare professionals. Sir, we all started at one point of time. I still remember Dr. Vidyasagar sent me the message today morning. He called me in the morning. He was the person who started neonatology, like training of senior professors in the entire country. We just started with doing NRP training, neonatal resuscitation program training, and we moved from one place to other. It started in 1989, and we used to go from one place to other and keep on teaching people. And we learned the way to connect to people is first understand them, respect them, know their name, what they are doing, what problem they have, then do teaching. Teaching education is not when people have their closed mind. It is only when their mind is very receptive. That only happens once you win them. Once you win them, you hammer whatever you want to teach them, they will learn it. And sir, I'm so happy that we started doing that in the UG third year, fourth year NRP, and that program still is continuing at AIMS for UG education and BSc nursing education for the last now 33 years NRP. But the new program is with the advanced form, new NRP additions which have come. The one thing which I wanted to do in a big way, and sir, you know that I have told that to many of the leaders and converted a lot of leaders, is it is not quality assurance. It is not also quality healthcare. People confuse. I tell we need people who can do quality improvement. Quality improvement is you don't need money, you don't need resources. Within that same environment, how you can work together, improve the processes of care, and then cut down the cost and make the better experience of care for the families and the patients. With patient safety, which has to be in center stage. So it is quality improvement, sir. We confuse it with quality assurance, which is the SOP, structure, manpower, resources, supply chain. We are talking of quality improvement. And what I found was, because I was very keen from the very beginning in the last so many years for pushing nursing education in newborn. Then what I realized is the frontline people who can make and improve the processes of care is the nurses. Made the team of nurses with champions at AIMS. Aparna is one of them, Parijat Chandra is another one. Lot of nursing champion and faculty members as champions who took that forward, not only at AIMS, at the other places. But it was that passion, because I had that we should do no harm to the patient, sir. We keep on talking, do no harm to the patient, but we want antibiotic stewardship to be followed. People will not do it with lectures, PowerPoint, webinars. We need to show them how to track it, how do you get it done, how you can have antibiotic restriction. And I'm so happy our colleagues in the Department of Pediatrics like Rakesh Lodha steered that and converted a lot of younger faculty members that we need to contribute to antibiotic stewardship program by tracking, by making policy, by making apps on mobile phone. Sir, in our department, you need to go, sir. Okay, yeah. So I think मैं तो बोलूँगा सर, मैं तो बोलूँगा ही सभी लोगों को सर. I have to. Thank you so much, sir. Thank you. So the other thing for younger people which I want to share is, the AIMS has a brand value. This brand value gives you a springboard for doing something which is extraordinary. It can take to you extraordinary heights, but this brand value is behind you, and this is a springboard it is providing to you. You need to ask, what do you want to do? What is your passion? What do you want to take it forward? There is all support from the administration for whatever, because there is no interference, especially for younger faculty member. For people who are doing maybe education, research, or clinical care, whatever, or innovation you want to do, any field you want to do, it provides you that support and the spring. So if you go outside, you may think you are great yourself. No, you are not great. It is the AIMS brand value which is pushing you. Even for the staff which is working here, in the office staff or administration you are working, or you are in research staff, I think is AIMS brand value which gives you the name. We should not forget that. And based on that, whatever you want to do it with sincerity. And then always respect the other people and work as a team to do whatever you want to do. So for me, teamwork is very crucial. And then for that, we have to have real good leaders and champions. And I see my faculty colleagues, senior or junior, they are just like leaders. Leaders, I would say, Arvind and his team in nephrology, they are leaders in that field. In research, they are leaders. Sushil, pulmonology, Rakesh, intensive care. So all of them are leaders. Ramesh now is a future leader after I leave from tomorrow in neonatology with his team of able faculty members who are with him. And then Shefali, neurology, and her team, Rachna and her team, Madhulika Kabra and her team in genetics, rare disorder. You know, Department of Pediatrics is one of the best rated department in the entire institute, not only in the institute, in the country. It has the distinction of having 2 WHO collaborating centers. It has the distinction of having 3 advanced ICMR centers. It has 2 centers of excellence within the same department I am talking, and multiple super specialties with so many DM students, so many research product publications which are happening. I think it's a unique department. And the best part is people work together as a team. And I'm very sure, madam, you are Dean Academics. You must have heard complaints from various departments. You never came back to me, Dr. Deorari, तुम्हारे department में ये problem चल रही है. कभी नहीं हुआ. So this is the legacy of Department of Pediatrics. It is not by me coming there. I was handed over that legacy by the previous forefathers and gurus of Department of Pediatrics who were there on the chair of Department of Pediatrics. And I'm very sure Arvind will take everyone together, and then this is going to continue for years together. You know, hospitals are run while we provide services by the nurses. Nurses are the key healthcare provider, frontline healthcare provider who connect to the families, to the patients. They stay 24/7. And that is the reason I realized 25, 27 years ago that without putting and investing on nursing, India will never make a progress. And I have a very strong belief on that at this point of time also. I always see nursing profession taking leap in the form of that we must have neonatal nurse practitioner or a pediatric nurse practitioner, or ER must have nurses who are trained in transporting patients and taking care of patients for doing triaging. Or even in cardiology, we need to have nurses who can manage ICU, special training. But as senior healthcare professionals, my request to all profs is kindly support them. Support them is by creating avenues for them. Not only they will have degrees and fellowships, avenues for them for promotion up the ladder so that they become leaders in times to come and create more of their lineage so that more and more hospitals are going to be run. This country cannot afford too many doctors who will run the health and wellness centers or even peripheral, because doctors don't go to the peripheral PHCs and district hospital. Why can't we have nurses of that caliber that they can manage patients who can be taken care of as a primary care doctors? Is all possible, but we have to think out of box, and then we have to invest, and this can't happen by us, but our voice can make that policy change. And then political leadership also can come on board. So we should think about that. So as I said, my passion has been promoting nursing in a big way, doing quality improvement in a big way, and then patient safety in forefront. You do simulation-based teaching learning only for the reason you want to improve the process of care. Time to giving thrombolysis or giving a patient who has got to be done angiography. How can you reduce that time? By training the people who are there in the ER, by doing simulation time and again, you reduce the time. You don't want to miss that golden period. It can't happen sitting in cardiac labs that you can reduce the time. You have to go out from those labs and see where are the places which can be easily gap areas which can be fixed by improving the processes. So that is the way the future of education is going to be, and we have to start thinking towards that. So in the last, I don't want to take too much of time. I would say, number one, whatever we are, I think it is our destiny which has given us this opportunity of coming to AIIMS. And I would say, especially to me, a person coming from a family where there is no one as a doctor, just by luck, and then entering at AIIMS New Delhi, I never knew I will get here. But my dad said long ago, if you have to get into MBBS, दिल्ली में ही लेना पड़ेगा, पैसे नहीं है कि ट्रेन की टिकट देकर इधर उधर जाओगे तुम। तो हमने मौलाना आजाद का एग्जाम दिया, 8th पोजीशन ली, श्योर थे कि एम्स में एडमिशन हो जाएगा। रिजल्ट निकला, 31 लोगों के नाम आए, हमारा नाम न्यूज़पेपर में नहीं था। बहुत दुखी हुए, कन्फ्यूजन हो गया कि 340 रुपये उधर फीस दे दें या क्या करें। तो तब तक एक टेलीग्राम आ गया 7:30 बजे सुबह घर पे कि भैया एम्स का इंटरव्यू देना है। हमने कहा ये क्या आ गया टेलीग्राम। अपने बड़े ब्रदर को, गौरव के फादर को भेजा गया, इंस्टीट्यूट में जाओ, 510 210 नंबर बस आती थी। ये एक जंगल टाइप की चीज़ होती थी उस समय, क्योंकि एक ट्रेन का रास्ता आता था, वहाँ बस रुक जाती थी। वो आए यहाँ पे, रजिस्ट्रार ऑफिस गए, ढींगरा साहब के पास, पता लगा कि भैया यहाँ टाई हो गई है, 4 लोगों के बराबर मार्क्स हैं। तो 4 सीट जो बननी है, 31 के 35 ओपन सीट होती, चारों को इंटरव्यू देना पड़ा, 5 लोगों को इंटरव्यू देना 4 सीट के लिए। इंटरव्यू को आए, डायरेक्टर जहाँ बैठते हैं उसमें डॉक्टर रामालिंगा स्वामी सर बैठे हुए थे, बगल में डॉक्टर केशवानी, साइड वाले में बो टाई लगा के, हम जैसे निक्कर पहन के बंदे जो हैं उनके सामने पहुंच गए। वो पूछने लगे, कुछ पूछा, उसके बाद कहते, मैं दोबारा से रिपीट कर रहा हूँ, ये व्हाट डू यू थिंक अशोक, व्हाट इज, कैन यू टेल अस समथिंग अबाउट जीन। हमें जो कुछ आता हम बोल के आ गए। वहाँ पे बाहर निकले तो पता लगा 5 में से एक बच्चे का अपना वो 12वीं का जो एग्ज़ाम है उसका सर्टिफिकेट नहीं पहुंचा था, नंदी का। तो हमें हल्के से बोल दिया गया, भाई तुम 4 का तो हो ही जाएगा, चिंता मत कर। घुस गए। तो ऐसे करके तो हम MBBS में घुस गए, और फिर जैसे जैसे जो चीज़ आती गई उसको हम पकड़ते चले गए, लेकिन करा हर काम जो था दिल लगा के किया, मेहनत के साथ किया। दूसरी चीज़ जो मैंने सीखी, मैं आप लोगों को रिक्वेस्ट करूंगा, अगर आपको प्रोग्रेस करना है जिंदगी में, तो यू मस्ट क्रिएट मोर लीडर्स, and these leaders and champions should not be within the 4 walls of the All India Institute of Medical Sciences. If you want to get a big recognition, look out of this, start thinking something which is totally out of box at a scale and big scale, and then try to find out individuals who have that capability of being a champion and a leader to lead more people. By doing that, what happens is you increase the number of hands which can convert your vision. You want to help the children or newborn or the mothers. But if you have multiple leaders, you will see only 20. If you create 100, they will see 2,000. So this is how you do and pass on what your vision is to the other people, give in their hands, and they take it forward and forward. And you can reach far and wide, not only in the country, globally in many of the countries. So I learned that technique of connecting people, and I think all that credit goes to Dr. Mehran Singh. He told me, Ashok, if you have to do one day, he said, Vinod was on that side, I was on this side, he was in the center. He was handing over some certificate to both of us on neonatal ventilation training. And I still remember American and Canadian faculty was here in this very room. And sir told me, Ashok, if you have to do something, ये जो है ना, ये इंस्टीट्यूट में ही तुम वर्कशॉप करते रहोगे, लोग आते रहेंगे और सीखते रहेंगे, उससे कुछ नहीं होगा. You have to move out, get out from here. And that is what itched into my mind. And one of the Canadian, Doug Macmillan, he told me, if you do something outside, make it a sustainable model. Ask people to pay the money, but don't take from pharmaceutical and companies and instrument company. Ask people to pay the money for the learning they will get so that you are able to sustain it. And I think I found out that model and moved with a lot of people in the country. Use the money of the people who want to learn. Use it to sustain it. And then whatever is left over the money, put it on nursing education, because that is also so important for. So this is how I moved, and my vision that lot of people in the country, Ramesh will vouch for that. And if you want to see that, come on 6th of March to Ibis Hotel. They are all flying over from India to just again do a celebration for me. So I think that is what you can do, and you can do only, and AIMS provides you that opportunity. And see, research section provides support for research. But I was so lucky that we used to do research or education by doing multiple APWs, agreed planned work for the World Health Organization, for the UN organization. And we had the opportunity of bringing that money to the research section, disperse that money wherever it is getting used to. So that type of support, where else you can find out? You go to another institution. You have no avenues to bring the money from the UN agencies or WHO or UNICEF. No way out. So you can bring those, pursue your vision, support administration from the research section. That can all happen. And lastly, I would say, all my office staff. I say, मंजू जिस थोड़ा सा बोल के गई, डर रही थी बोलने से. आपको पता है मंजू जो है हमारे डिपार्टमेंट की, वो होता है ना कार ड्राइव करने वाली, स्टीयरिंग में बैठी है. HOD जो है, जो आते हैं, वो तो वो कागजों में यूं यूं, सारे के सारे रेजिडेंट, मैडम आई टेल यू, सारे रेजिडेंट, DM हो, SR हो, JR हो, कनेक्शन उनका सबसे पहले मंजू है. And thank you, Manju, for taking this responsibility. And I think I must be the 4th or 3rd faculty HOD. I am very sure she will get an offer. Anyone who becomes the next director will pull her कि इसको वहाँ ले आते हैं. But I am very sure she is going to support Arvind Bagga and the other people also in times to come, because you have long innings with you. And she is ably supported by Nidhi, Ravi, Umakant. So they provide you that support in the Department of Pediatrics. Thank you all. And all the resident doctors, all the SRs who have come over for this celebration. And I don't know, NK Arora ने कहाँ से सुन लिया कि NMC वाले बुला रहे हैं, ये कर रहे हैं, वो कर रहे हैं. ऐसा होता है, हर पुडिंग को आपको पहले देखना पड़ता है कि क्या TOR हैं, क्या काम है, तभी तो आप डिसाइड करते हो कि आप क्या करोगे. अगर आपको दिल से कुछ चीज़ पसंद आएगी तो आप उसको करने के लिए आप अग्रसर होगे. सो वो देखते हैं क्या होता है. मैं हेल्थ मिनिस्टर ने भी मेरे को बुलाया था, फ्राइडे को नर्सिंग की वो थी, उसके बाद मैं मिला उनको 30 मिनट के लिए, लेकिन वो देखेंगे क्या होता है। मेरे हाथ में कुछ नहीं है ये मैं आपको जो बोला शुरू में, पहला सेंटेंस मैंने आपको, MBBS में कैसे घुस गया मैं, क्या हुआ मेरे को नहीं पता है, मेरे को नहीं पता है मेरी डेस्टिनी में क्या लिखा हुआ है, और वही होगा जो उसमें लिखा है। मैं तो एक तरह से कार्य करता हूँ उसको निभाने के लिए, चाहे इट में भी ए बिग हॉस्पिटल विच आई हैव टू रन एंड गाइड पीपल और कनेक्ट। मेरा दिल जो है कनेक्ट होता है यंग जनरेशन से, यंग माइंड से, बिकॉज इनको मैं एक तरह से सोर्स ऑफ पावर एंड एनर्जी मानता हूं, तो इनके साथ ही आप सबसे ज्यादा सीखते हो। तो मेरे को दिल की खुशी वहां है, यंग जनरेशन के साथ है, पावर बैटरी के साथ है। मैं अपने आप को तो एम्प्टी कंप्यूटर स्क्रीन समझता हूँ, विदाउट एनी पावर, वो फ्यूज हो जाता, गायब हो गया, कुछ नहीं आ रहा, संजीवनी कुछ नहीं आ रहा, खाली है। तो जब तक ये पावर नहीं है तो कुछ नहीं होगा। सो मजा उसमें है, जो मेरा दिल कहता है कि मजा उसमें है, और इस तरह का ही काम करना चाहिए। इफ यू कैन मेंटर पीपल, गाइड देम, devote time, and these are our future people. I would even connect to BSc nursing students, first year, second year, nurses who are working in the ward. I think they are doing tremendous job. Without them, healthcare delivery system is fused, zero. You may have a wonderful faculty member and a clinician who can write drugs and medicine and everything. But once your patient is sick, it is the nurses who make all that difference. So we need to take them on fold, work with them, and if we have the opportunity of guiding them, making them good leaders with good avenues, progressing their education forefront, in addition to MD resident are also important. Even UG students are so important. So we need to do all this. So thank you all for coming for this celebration. I am very sure this celebration will last much longer. And again, as I said, I would keep on working till God gives me energy. Unless he asks me, Ashok, अब तुम्हारे लिए ये बेड आ गया, इस पे पकड़ो, इसको छोड़ दो, अब काम करना. Otherwise, I am going to work wherever I am, and I'll keep on doing the good work. And it may happen, it will be better work, because I'm little bit now free bird now. Over next 3-4 weeks, I will think through what is there in store for me and what I need to walk through, and I would do what my heart would say. I always tell people, number 2, you listen, brain is wavery. It gives you huge ideas. But look at your heart, what it is asking you to do. Is it syncing with what your brain is teaching you? Unless it is in sync with that, you would be in wrong path. Second advice I give to all people, younger people also. If you get married in future, and if you have children, if you don't mentor them properly and educate them and give adequate time to your husband or to your kids, then you are in trouble. You are in trouble. You are not doing that duty what God wanted you for doing procreation, bringing someone in this world and then to make a future good human being, whatever he or she wants to do. So if you have that, you have to do academics, research, whatever you have to have your family life and family time, which has to be on topmost priority. These two things. First is heart and brain. Listen to your heart, not to this. Second is about your family life. If you want to get married, have kids, you must have a focus and give time to your child to make him a real good human being, so that you are proud of at the end while comes to you, that you don't have to worry about your children who are going to be future, whatever they do, whatever profession they choose. So my best wishes to all my faculty colleagues, all the resident doctors, all the nurses, all the research staff, everyone who has come for this, and especially Madam Dean, both the deans, Richa and Kritika and everyone, Aditya, who has organized this function, and all the faculty members who have come from various departments to give their time. N.K. Arora, Vinod Paul's brother, Vinod is busy somewhere, so Bindi is there, younger brother Varinder, he is also V.K. Paul. ये भी उसका फायदा लेता है, विनोद पॉल का फायदा लेता है जगह जगह. वीके पॉल, वीरेंद्र नहीं लिखेगा ये, वीके पॉल. And N.K. Arora, who also joined. And thank you so much. And I'm really touched, honored with your words. And I look forward. You are going to be in my big field. Whatever I do, I would still be connected wherever I am with each one of you. Thank you so much.